call centre working is a danger to your mental health. Depression, anxiety, panic attacks, difficulty sleeping, even suicidal thoughts are common amongst call centre workers. More than 4 in 5 respondents to a Unison trade union survey said that work made them stressed. In another survey, when asked how workplace stress affected them, more than 1 in 5 call centre workers said that they had called in sick in order to avoid work, 14% had resigned their jobs, and a further 42% had considered resigning. So, how does call centre work cause mental health problems? There's verbal abuse from callers. That Unison survey showed 86% of respondents had experienced verbal abuse. There's no recovery time between calls, constant pressure to work harder and faster, noisy, busy, open plan offices with uncomfortable workstations and an oppressive sensory environment with poor ventilation, temperature, lighting problems and so on. Then there are the managers cracking the whip to meet targets that are impossible to meet. It seems obvious that working conditions are the problem, and yet the solutions we're usually offered for mental health problems address the symptoms, the effects, rather than these causes. We get mental health awareness campaigns, patronising lifestyle advice, mental health first aiders, counsellors and so on. And while these measures may alleviate some problems in the short term, they add to the idea that the problem is with the worker and not with the workplace. If you were in a job where workers repeatedly had physical accidents, for example falling from heights or getting mangled by machinery, and the employer said, "It's okay, we'll train more of you to be first aiders," I think you'd say that was inadequate. I think we'd say that's all very well and good, but what the employer really needs to do is to stop the accidents happening, to make the workplace safe. Well, the same principle applies to mental health at work. Yes, it's good for employers to provide mental health first aiders or other support, but it would be better still if they stopped driving us to distress in the first place. Moreover, it seems that some employers are using counsellors to manage people out of work. You do your course of 6 sessions, and if after that you're still struggling, that's it, you can't do the job and you have to go. So to tackle the mental health crisis in call centres, we need to change the workplace. We need manageable workload, secure employment contracts, decent pay, shorter hours without loss of pay, a comfortable working environment, adequate breaks, and workers' control over the conditions that we're working in. How do we get this? The employers are not going to give it to us out of the kindness of their hearts. And arguments that protecting workers' mental health is good for business will only get us so far. We need to organise. Join a trade union and form an active union group in your workplace. Identify demands, put them to your employer and prepare to take action to fight for them. Even doing that may improve your mental health.